The intended audience for this video is healthcare professionals. The purpose is to help educate healthcare employees on the struggles of sex and gender. Gender is defined as male and female. This is how one identifies themselves as. Sex is the biological makeup of a person, for example, the reproductive organs they were born with, as well as the hormones produced by these organs. Here's a scenario of how complex it can get when treating a patient based on their sex, but also wanting to respect their gender preferences. A woman who presents themselves of the opposite sex comes to the ER with symptoms of AFib. Protocol is to chart the patient for their sex that they were born with. In this case, for example, female. The patient does insist on putting male because that's how they identify themselves as. Here's the problem. Women have a higher risk for a stroke, therefore it affects their treatment process. When it comes to antiarrhythmic medications or blood thinners, they require a smaller amount than men because of the risk of hemorrhagic bleeding. EHR systems now can calculate treatments based off signs and symptoms, but they rely on information such as sex. That way it's super important to put what the biological makeup is. The risk factor for this scenario would be mistreating or misdiagnosing the patient because of how they identify themselves. Ways to overcome this are set protocols and education to the staff. I still think we need to put their biological sex, but still respect the patient's preferences when it comes to communicating with them. Lack of gender-based medicine negatively impacts patients in ways where they might be scared to come and get treated. There's always the fear of judgment, which is a huge issue when it comes to those who identify as male or female who weren't born a male or female. There should be set protocols in place. For example, the terminology we use for employees as well as EHR systems. This way, those who do identify as opposite sex can feel safe and get treated the way they should be treated and still feel safe in a healthcare environment. New approaches for gender-based medicine stem from research. Everyone is born with a reproductive system, but that doesn't always mean it will match up with the gender they want to identify as. Sex and gender are definitely different, and every healthcare employee needs to understand the difference. More research needs to be brought up to show the importance of gender-based medicine. Understanding the difference between sex and gender benefits the care of patients, but also promotes clinical practice. Teaching new physicians gender-based medicine so they can practice it. Medicine and healthcare is for the patient. How you practice can critically affect overall health of them. In conclusion, sex and gender needs to be a learning topic in both school and the healthcare profession when it comes to gender-based medicine. Here is a little bit more about gender-based medicine. Gender-based medicine incorporates information of one's biological sex and social cultural aspects of gender that affect health and illness for women and men. It is a huge category that acknowledges both the biological and social cultural of women and men's health that help manage health and disease. There is a relationship between sex and gender and health outcomes. In any healthcare setting, it is important to clarify the terminology of sex and gender, whereas in public places, it can be used interchangeably. Men and women are alike in very many ways. However, it's important to know the biological difference and behavioral differences between the two genders. These affect the pathophysiology and diseases of their health. Again, here are examples of diseases when it comes to differences in sex. Women with heart failure receive fewer guideline-based diagnostic procedures and treatments. Nevertheless, women have a better outcome than men. Women with AFib receive less anticoagulant treatment with warfarin, even though they have a greater risk for stroke than men. Women obtain dialysis later than men and undergo fewer kidney transplants from both living and deceased donors. There is a significant delay in referral of female patients with rheumatoid arthritis to an early arthritis clinic in comparison with males. Osteoporosis and depression are considered female diseases, and both might be underdiagnosed in men. These are all great examples of why your biological sex is super important when it comes to healthcare, but it's also super important for healthcare employees to know the difference between gender and sex. Now that I've researched gender-based medicine and know more about this topic, I'm going to get an outside view. I'm going to ask a series of questions to someone who's never worked in the medical field nor knows much about gender-based medicine, and here's the replies. What do you think is the difference between sex and gender?
Sex, I would believe, is what you are born, male or female, and gender would be what you classify as.
Do you think sex and gender can be used interchangeably?
My opinion would be yes.
What do you think gender-based medicine is?
I would have no honest clue what that actually means.
And this concludes this video. Thanks for listening.